Bismillahirrahmanirrahim. Assalamualaikum and good afternoon to everyone. On behalf of National Institute of Health, I welcome you all to today's webinar, which is titled From Detection to Response, Enhancing National Preparedness under the Global Health Security Agenda. I'm Dr. Masab Umair. I'm working as a Principal Scientific Officer and Head of Virology Department at NIH. And today I have the privilege of moderating this webinar. So before I start, there are some housekeeping rules. So first of all, I will request everyone to please make sure that their mics are on mute. This webinar is recorded and the session will be available at our Insights YouTube channel. So if you are interested, you can watch it later on as well. We strongly encourage our participants to ask questions. So if you have any questions, you are more than welcome to post them in the chat box, or you can later on ask directly to our speaker. So it's my pleasure to introduce our distinguished speaker for today, Dr. Mumtaz Ali Khan. Dr. Mumtaz is a seasoned public health professional with nearly 24 years of experience, including 15 years in field epidemiology and communicable disease control. He is currently serving as the Chief of Center for Disease Control at the National Institute of Health, Pakistan. In addition to his critical role, Dr. Mumtaz serves as the Deputy Coordinator of the Public Health Emergency Operations Center, Coordinator of the Pakistan Field Epidemiology and Laboratory Training Program, and National Focal Person for Infection Prevention and Control. He has authored over 75 peer-reviewed publications and represented Pakistan in more than 30 international conferences. Dr. Mumtaz was the founding resident advisor of the Qatar FELTP and currently leads the CDC-funded Cooperative Agreement on Antimicrobial Resistance and IPC. He is also leading the development of Pakistan's National Action Plan for Health Security. We are truly privileged to have him with us today to share his insights on enhancing national preparedness and operationalizing GHSA targets in Pakistan. Dr. Mumtaz, thank you so much for joining us. The virtual floor is yours.
Thank you so much, Dr. Masab, for giving me this opportunity to talk to the audience about very important topic, and especially for Pakistan-like countries. International health regulation, global health security agenda, and One Health approach, and everything is very important. So today's discussion will be introduction to all those topics. This talk is just an introductory talk. I will urge the participant to ask questions if they need more details. We are available after this session as well, online, on WhatsApp, and on emails, and even they can visit NIH sometime, and we can have more discussion on all those topics which we are discussing today. So my presentation will not be very long. I will go briefly on each slide. So the topic given to me was From Detection to Response, Enhancing National Preparedness under Global Health Security Agenda. And this is basically regarding pandemic preparedness in Pakistan. And you know that recently we have been passed through a pandemic, that is COVID-19. And everyone experienced that how Pakistan dealt with that pandemic, and what was the difference as compared to other countries, that we did well, and we progressed, and we saved lives and saved our nation, trade, and decrease and reduce and minimize the mortality and morbidity. So I will be going forward. So today we'll be discussing IHR 2005, just an introduction, Global Health Security Agenda, Joint External Evaluation, National Action Plan for Health Security, and briefly about One Health approach. And this all topics are very much related to the main topic, that is detection to response. So this will be focusing on how Pakistan can strengthen its detection and response capabilities for pandemics under Global Health Security Agenda framework. So there are 2-3 main topics which the participant needs to be very much clear, and they need to understand about this. This is One Health, international health regulations, Global Health Security Agenda, Joint External Evaluation, National Action Plan for Health Security, and One Health approach. So I will be trying to connect all those areas with each other and make one topic for understanding of the audience. So, what is global health security? Why we are concerned? Because there are multiple emerging and re-emerging infectious diseases, like we experienced during 2019, the H1N1, which was called swine flu as well. Then in 2003, it was SARS, and then MERS-CoV, and then Zika, and then we experienced COVID-19, and nowadays we are working on mpox. So all those are emerging and emerging infectious diseases, including Ebola and other diseases as well. So globalization, because one disease in one area is threat for other areas as well. So disease can spread from one part of the world to another part of the world within 24 hours because of global trade and travel. There are several serious and unusual disease events, and also there is a risk of deliberate use of biologicals, chemical agents for biological wars, which impact health, economy, and security. So that's why we are concerned, and globally, everyone is concerned about global health security. So for decreasing those impacts on travel and trade and health of the population, uh, this is an instrument that is called International Health Regulation. And international health regulation is legally binding agreement for every country. And up to 196 countries have signed this agreement. And this was established in 1969, then revised in 2005 and entered into force in 2007. So you might have heard about this international health regulation. This was the timeline. In 2007, it was implemented in few countries and then started implementation in other parts of the world. And now it is the last extension for implementation was 2016. So we countries like Pakistan are still trying and striving to implement international health regulation in all parts of the country. So we are one of those countries where we still have to try and to establish international health regulations. So this is a legal binding, and this gives mandate to countries to monitor and promptly report any potential global health risk. So global health risk includes diseases, events like chemical events, disasters, and everything which can be a risk for other countries around the world. So IHR requires countries to be well prepared to prevent, detect, and report and respond to disease outbreaks and health emergencies to minimize disruptions to trade and travel around the world. So there are four main areas: prevent, detect, report, and respond. We will be discussing this one by one. I will be talking about the global health security agenda now, and I hope that everyone knows about IHR. And if you need more information about IHR, there's a booklet of IHR on the web, and also available information at NIH website. So GHSA is basically launched in 2014 to provide structure to help countries to reach IHR compliance, because there are many areas of IHR when we have to implement all those areas in true sense and true spirit to attain a world safe and secure from global health risk and diseases. GHSA is multilateral and multi-sectoral area which works for prevent avoidable catastrophes, detect threats early, and respond rapidly and effectively to strengthen global nations' capacity to prevent, detect, and respond to human and animal infectious diseases and other events. So there are many areas in global health securities. We can say 19 areas, but 11 global health security action packages are there across three priority areas and to achieve three critical health security impacts. So the 11 areas are: under prevent, we have antimicrobial resistance, which is a big issue in countries like Pakistan, and zoonotic diseases, which are diseases which comes from animal origin to human side, biosafety and biosecurity, immunization. Under detect component, we have national laboratory system, real-time surveillance mechanism, reporting, and workforce development, which include training of healthcare staff and doctors and other staff. And under respond capacity, we have emergency operations centers. We have linking public health with law enforcement and multi-sectoral rapid response. And this was really since during COVID response that we had an NCUC, which was Emergency Operations Center. Then public health was linked with law enforcement agencies, other stakeholders like industries, like police, like security agencies, like public, like educational institutes, and everyone was responsible and have parted in this COVID response. And medical countermeasures and personal deployment, like you deploy professional people from one area to another to cover emergency operations. And all the three areas to prevent avoidable risks, to detect threats early and report early and respond early. So these are the areas of global health security agenda. So what is the progress to GHSA? GHSA during up till 2028, there are some targets which we have to cover along with the global community and other countries. So to complete evaluation of health security capacity, undergo planning and resource mobilization. So till date, we have 123 countries have completed their joint external evaluation. This is a mechanism to evaluate IHR capacities and GHSA capacities. And the progress and target of 2028 is more than 100 countries to have met all those targets. So Pakistan is trying to be in those countries which can meet their targets for IHR implementation. So now we will be talking about joint external evaluation. So international health regulation we talked about in the first few slides. This is a legal binding to all the countries. And then for IHR implementation, the mechanism of global health security agenda was there, which was launched in 2014. And there are 19 areas and 3 main packages under detect, prevent, and respond. And now the joint external evaluation is a mechanism to assess the countries that how they are prepared and all those 19 HR and GHSA areas. So this is a voluntary collaborative assessment of countries' ability to find rapidly and stop and prevent diseases and outbreaks and to avoid public health threats. So the JEE is a comprehensive process. The documents are available online. You can read much more in detail. And this is basically, there are 19 areas under prevent. There are 8 areas under detect. There are 3 areas under respond section. There are 5 areas. And under IHR related hazard and point of entries, there are 3 more areas. So all those 19 areas are assessed by international teams. Different teams from other countries comes to your country and they assess your capacities, all those countries. So Pakistan was the first country in EMRO region, which we undergone first joint external evaluation in 2016. And then the second joint external evaluation we completed in 2023. So we were the first in our region to complete 2 joint external evaluation assessments with international teams. And now our deficiencies and we have the national action plan. So these basically the joint external evaluation assess any capacity out of those 19, like financing, like zoonotic disease, like food safety, in 5 basically areas where we don't have any capacity. So that is limited capacity, no capacity, and which is in red. And then the second is we have some capacity we have that is limited capacity. So the score is 2. And when we have developed capacity, the score is 3. When we have demonstrated capacity, the score is 4. And when we have sustainable capacity in that area, the score is 5. So we talked about the 2028 GHSA target. So more than 100 countries must have demonstrated capacity. So they must be on score 4 for all those 19 areas for which we are trying. And inshallah, with the help of all the stakeholders and with the support of Almighty Allah, we will be succeeded, inshallah. So the objective of the joint external evaluation, especially for Pakistan, was to assess the implementation of IHR capacities for surveillance and response to public health events, and to identify the progress and gaps in implementing IHR capacities since 2016 and difference between provinces and in comparison with there is another report which is annual report for IHR. So we do that every year like JEE and recommend priority actions to update and finalize the national plan and to achieve and maintain IHR capacity for global security. So in short and simple words, the JEE assessment will identify the gaps and strengths, and based on those gaps and strengths, any country have to make their action plan for next 5 years. So what progress we made from 2016, the first JEE, till 2023, the second JEE. So with those 6 to 7 years, we progressed much more. Like we started developing legal instrument, legal acts for public health. We started joint investigation and response for zoonotic diseases with livestock and environmental department at national and provincial level. We progressed in immunization coverage through expanded program for immunization. And to remind you that this week from the last week of April is immunization week throughout the world. So we developed IHR committees at national and provincial level. We dropped national food safety strategy and policy. We enhanced the diagnostic and sequencing capacity in the country at provincial and national level. And we developed the antimicrobial resistance national action plan and start reporting and surveillance of healthcare associated infections throughout the country and few hospitals and central sites, and policies and SOPs for laboratory and biosafety, biosecurity, and also the big program in Pakistan, which was integrated disease surveillance system. We established in 2016, and till date, we have completed almost 100% in primary and secondary healthcare, and now we are moving toward tertiary and private sector. So this is success story of Pakistan, especially for IDSR and laboratory network. And you have witnessed this capacity during COVID response. Also, we started capacity building program, training programs for healthcare staff, and I will definitely inform you about the APTP program, which is a flagship program of Pakistan. And this was established in 2016, and today we completed the 15th cohort of this program. So this is a field-based program which is accredited globally, and that is in 100 countries around the world, and Pakistan is one of them. So we worked with Global Outbreak Response Network internationally, and our teams have been deployed over there in different countries to respond with international community. We started community-based programs for immunization and health education and risk assessment. Risk profiling we started in the provinces. We have public health emergency operations centers at federal and national and provincial levels, which are actively participating and working during outbreaks and epidemics. We establish the point of entries and strengthen those point of entries across the country, and to inform about the point of entries. These are the areas like airports, ground crossing, and seaports from where internationally we are connected to other parts of the world. So especially during COVID, those point of entries and those units were especially strengthened and now working 24/7 and screening the travelers across all the airports. And that's why we are getting mpox cases from abroad, and that is being identified at the airport level and isolated, and we don't have domestic transmission in the country because of that active part in at point of entries. We have expanded the response capacities. Also, we developed the case management guidelines for different priority diseases. We have almost 35 priority infectious diseases, and the booklet is available on the website and NIH website. You can download and study that booklet as well. And also capacities for managing radiation emergencies. That is really another important area where this is the only area where we have 5 score through JEE. So this is very developed area. So this is basically the joint external evaluation 2016 and then 20 2023. So in 2016, in many areas, we have score of 1 and 2, and next 5 to 7 years, we develop one step above, two step above in all those areas. So this is the progress of Pakistan in implementation of international health regulation, and also in developing the 19 capacities, 19 areas and capacities from 1 to 2 to 2 to 3. So this is really good progress, and we are striving to make more progress in upcoming 5 years, inshallah. These are 19 areas. I will not be going in detail. This is available on NIH website. Anyone can study this. So in the red areas, we are at 1 and still at 1, and we need to work more for those areas. The green areas are demonstrated capacity, and that is good capacity. The yellow and the other areas, we have to work a lot. And this is basically a challenge for healthcare department. And also through multi-sector coordination, we have to work to develop those capacities. This is the summary of joint external evaluation scores for Pakistan. So under prevent component, which include legislation, financing, HR coordination, antimicrobial resistance, zoonotic diseases, food safety, biosecurity, and immunization. Our score is 43%. So this is less than 50%. And in detect capacity, we have national laboratory system, real-time surveillance, workforce development, where our score is 47, and response capacity, which include emergency management, and response linking public health with security authorities, and health service provision in hospitals and healthcare institutions, infection prevention control, and risk communication. We have very low score, that is 36. And the other areas, this include point of entries, chemical events, radiation emergencies, where we have good score, that is 54. So we have to score up to 100. And that is a big challenge for Pakistan right now. So that's, as we discussed, Pakistan was the first country in Eastern Mediterranean region to opt for JEE in 2016 and then in 2023. So the overall score, including all those areas, our score is 43.2, which is definitely less, and we have to try more. So what are the recommendations of the JEE in 2023? To increase domestic financing, because most of the areas we are working, we are dependent on donor funding, like immunization, like response, like capacity building. In many areas, out of those 19 areas, we are dependent on donor funding and foreign funding. So we have to increase the domestic financing for health security. We have to update the National Action Plan for health security. We have to institutionalize health emergency management at all levels, especially at district level and provincial level. We have fostered One Health approach, and we will be discussing what is One Health approach for prevention, detection, and response to One Health threats. We have to invest in sustainable multidisciplinary health workforce, which is very much needed in hospital and also as well as at the community and public health level for enhancing and ensuring health security. We have to continue and to strengthen surveillance activities. We have to increase diagnostic capacity, especially extended to district level. And we have to work on antimicrobial resistance, which is basically antibiotic resistance, which is very much a big area and big issue for all the countries, especially for Pakistan. And we have to create space for the two-way community participation, because without community participation, no any program can be successful, because without ownership of the community. So for gaining a score from one point to another, to escalate the score, there are few benchmarks which is developed for each areas by WHO and agreed by all countries. So you can study this in detail from the website. I have given few examples. Moving from 1 point to 2, you have to do all those activities. From 2 to 3, you have to do all those activities. Like this is available, and based on those areas, we have to develop our priority actions, we have to develop the action plan, and we have to develop all those areas. So this is a complete guiding document which is available on WHO website, and this is called International Health Regulation Benchmarks. And this is available for all the 19 areas and for all the scores. So now all of you understand that what is IHR, what is GHSA, what is JEE, and now we'll be talking about NAPS, National Action Plan for Health Security. And that NABS is for prevention, detection, and response capacities, which is 5 years plan. And we do develop this after every JE. From the first JE, we developed NABS and we worked on that, and that's why we progressed in many areas. And from the second JE, now we have developed the NABS and it is costed, and now we are working with the provinces to develop activities and to start working on the NABS. So results of the JEE and other country-based assessment can be used to guide the development of National Action Plan for Health Security. This is usually for 5 years. So this is basically through all of the government approach. The NAPS is developed collectively with the inputs from different governments like from livestock sectors, from provincial department, health department, from communication department, from industries, from every department. We take inputs when we develop a comprehensive national action plan, which is acceptable to each everyone at all levels. So we do develop this action plan through all those thematic areas which we studied during the previous slides, like under prevent, under detect and response, and other caps. We do develop this action plan for all those 19 areas. And this is very comprehensive national action plan, which is available with the provincial and federal health departments. And we have shared this with all relevant stakeholders. And the previous national action plan is available on the website as well. So the document is basically a guiding document for next 5 years, where all the governments, all the provincial governments are agree, and they are working to develop and to acquire domestic fundings. And if you know about PC1 is basically developed on all those areas in reference to this document. And also the donors, the partners, WHO, CDC, and other partners are providing support to Pakistan or any other country based on all those areas which the activities have been prioritized. So this is basically the hierarchy and policy and plans for National Action Plan. We do have a National Action Plan for 5 years, and then we have 12 to 24 months operational plan, which is being developed by the provincial health department at the provincial level, and then we have a monitoring and evaluation framework. So this is very comprehensive process which we do in 1 or 2 years time, and now we have been reached to the costed plan of this action plan. So now we will be talking about One Health. As you all know about the human health, but this is not only human health. Human health is dependent on animal health and environment around do we have, and also the agriculture. So One Health is an approach that recognizes that the health of people is closely connected to the health of animals and our shared environment, where we do have animals, plants, agriculture, and environment, and especially the climate. And you know that climate change has created a lot of issues for every country around. So to strengthen the health system, we have to work under One Health approach. And this is very important nowadays. So coordination, communication, and collaboration with One Health partners is very much important for preventing zoonotic diseases, preventing climate change catastrophes, and also environmental issues. So this includes emerging and re-emerging diseases like Ebola. It's a zoonotic origin disease. The COVID, it was also a zoonotic origin disease. The SARS, the swine flu, the MERS-CoV, every new disease and emerging disease, is 75% of those diseases are from zoonotic origin. So zoonotic origin is zoonotic diseases are the diseases which come from animal side to human side, like rabies, you can say like brucellosis, neglected tropical diseases like leishmaniasis, like dengue, like you can say the brucellosis. These are neglected tropical diseases. Vector-borne disease like malaria and like dengue and Zika. These are vector-borne diseases which come through any vector like mosquitoes. Antimicrobial resistance is very important area where we do consume antibiotics at animal side, agriculture side, and also at human side. So there's injudicious use of antibiotics, overuse of antibiotics in all the communities. So this caused the antibiotics to reduce their strength and effectiveness. And now we don't have much more antibiotics to treat simple infections. Food safety, this is very important area, and food security. Environmental contamination, environmental issues, climate change, all you know about it. So the shared environment by animal, plants, human, and everyone. This is called One Health approach. And we have to work together with other departments like agriculture, livestock, climate change, and environment to control the diseases and to make human being happy and healthy. Last few slides. This is summary of basically all those activities and topics we studied in previous slides. So the key components of detection system is surveillance, disease surveillance, laboratory networks, which we have throughout the country right now. After COVID, especially, we developed our laboratory network, and human resource development, especially the field epidemiology training program and public health workforce and clinical doctors and nurses and laboratory technician, technologists, and molecular biologists. All those comes under human resource. So the best practices in detection, we do have the surveillance, we do have real-time reporting through DHS2, through IDSR program, and this is implemented in more than 170 districts of Pakistan right now, and we do have weekly reporting at central and provincial level. We have cross-border coordination for few diseases like CCHF, polio with Afghanistan and Iran and other countries, and even because the travel and trade is through by air as well and also by sea, so we are connected with other EMRO countries and other countries through good coordination for disease control and prevention. We have sentinel sites in the country for antimicrobial resistance, for influenza, and for other such diseases to get data from there. And we do support One Health approach in all those areas, linking human, animal, and environmental health data. So we do have National Reference Lab, which is NIH, National Institute of Health, is providing free of cost diagnostic facilities for epidemic-prone diseases around the clock, and our teams are available around the clock over there. And you have witnessed this during COVID and even MPOX activities. We have a network of public health labs which NIH has developed with the help of provincial health departments. At all the provinces, we do have provincial public health labs, and NIH is supporting technically, and also we provide kits and other reagents to all those labs to make them operational and keep them operational. And Dr. Masib is basically coordinating all those activities with the laboratories. We have provincial labs in the hospitals, especially the district labs, influenza labs, and also the fungal surveillance labs. And this is available in different districts and divisions, which is in coordination with National Institute of Health. We do assure quality of all those tests and procedures through external quality assessment and through ISO certification. We do have the capacity for emergency detection, and this is we do have 4 mobile labs, that is by safety level 2 labs, and that is deployed in the provinces. And also we do have 1 lab at NIH level, and this is time to time we deploy this. Especially we deployed this lab to send during the floods, and that include all basic laboratory diagnostic capacities. So this is, we do have 4 labs which is available in different provinces. That is mobile lab. So what are the challenges there? Definitely fragmented data, fragmented information, limited resources we do have. We don't have proper financing for all those activities which we tend to do. We have delayed reporting due to certain reasons, especially the connectivity reason. We don't have proper event-based surveillance system, proper case-based surveillance system. And now we are trying to strengthen this surveillance throughout the country. And we do have underreporting because of weak incentive for frontline health workers to report the cases. And that is because of poor finances in the provinces and federal level. Especially we have funding for such activities. So we do have Public Health Emergency Operations Center at federal and provincial level right now, and they are working very much closely with National Institute of Health and in coordination with the One Health approach with other departments and other stakeholders. We do have rapid response teams at all levels, especially at district, provincial, and national level, which are ready to respond to any outbreak or epidemic during 24 hours. We do have public communication system. We do communicate with the public through messaging, through social media, through our website, and we do coordinate with other partners and agencies for good control and prevention of the diseases. And we do have medical countermeasures like stockpiling of vaccines, personal protective equipments, and antivirals, especially for rare diseases. So best practices for response, we do coordinate national action plans. We have developed first after 2016 and now after 2023, the NEPs we have developed, and this is aligned with GHSA and IHR multi-sector response. We have provincial emergency operations centers in Punjab, Sindh, Balochistan, and KP, and also in GB and AJK level. We have multi-sector collaboration with all agencies working in Pakistan, especially ensure that collaboration during floods, during outbreaks, and during we have a cluster approach, and we do have a monthly cluster meeting at WHO level where all the agencies and relevant stakeholders comes together and discuss the issues. We do have partner support from technical assistance in the form of technical assistance from global health agencies, including WHO, UNICEF, FAO, CDA, CDC, UKHSA, USAID, etc. And we have a good program in the country, Lady Health Worker Program. We include religious leaders for awareness of diseases like polio and other diseases. We have community-based organizations. We have social media alert system, and we do use that system for making awareness about any disease or any event in Pakistan, and especially for nutrition, infectious diseases, antimicrobial resistance, and other things. And we have hotlines 1166 like, and do respond to public for any issue, any query that is 24/7 available. So we have training program like field epidemiology training program and health services academies throughout the country, academia and other who do work and train the health workforce in their own areas. We do simulation exercises and tabletop exercises on different topics and different areas. This is a regular pattern and regular drill program, especially at NIH and also provincial level. We have international partnership with CDC, WHO for GHSA support and also for the trainings. We have the big issue which do we have, that is retention issue and brain drain, which you know better than me, especially the professionals. They go out of country and go out of government system to private setup, and especially to the partners and donor agencies. This is a big issue for retaining the main workforce in the health department. So the challenges in the response system are delayed mobilization, especially we don't have proper trained persons, especially at far-flung areas. And the access is another issue, and the security is another big issue, which we all know about that. We do have supply chain gaps, like national and provincial stockouts of essential medicine and adult vaccinations. And misinformation, as you witnessed during COVID, there are much more misinformation which is called which was regarding the vaccination, and which is also called infodemics, and urban rural disparities, which is a big issue in countries like Pakistan. We have limited healthcare access and capacities in remote regions. So under GHSA compliance in Pakistan, we develop short-term projects, medium-term projects, long-term projects, and also we have regular JE assessment and IHR assessment through monitoring. And this is all activities are coordinated from provincial to national level, and we do work together with the provincial health departments under one health approach. So what are the recommendations? Basically, to invest in one health approach, human, animal, environmental interface for surveillance and response, to strengthen the public-private partnership, to have good capacities, because 70% of the healthcare is at private level in Pakistan-like countries. So to develop a sustainable health emergency funds at the government level, this is very important, and to upgrade training for healthcare workers, and to do simulation exercise and practices to keep them equipped and updated, and to improve regional coordination with other agencies like WHO, like SARC countries, Gavi platforms, CDC, and other areas, and to have partnership with donor agencies and partners and other technical partners. So this was all about today's talk. I'm available for any question. It was a flying presentation because the topic is very comprehensive. We should have in-depth analysis of each and every area, but the time was very short. So thank you so much.
Thank you so much, Dr. Mumtaz. It was indeed a very informative and insightful talk. And as you rightly mentioned, these are big areas. And you not only discussed the GHSA, but you also gave a small overview of international health regulations, joint external evaluation. Then you also talked about the National Action Plan for Health Security. And in the last part of your presentation, you talked about One Health. So, you being the chief of CDC Pakistan, and also you are deeply involved in developing the National Action Plan for Health Security. So, what, in your view, are the key milestone if you have to figure out just one milestone in implementing the GHSA framework in Pakistan, and what is the main challenge that you see?
Thank you, Dr. Masab. Definitely, I discussed this during my presentation, but the main issue is definitely financing and coordination. We have to coordinate, we have to take all the provinces and districts and all the stakeholders along, and we should have domestic finances for all the areas, because every time now like if you remember that the US has stopped their projects and also decreased the funding for many projects. So we are much more dependent on those projects and those fundings. So we should have our own funding, domestic funding for more, especially for important areas under detect, response, and prevent areas.
Okay, great. And you are also, overseeing the FETP program in Pakistan. So how do you see the FETP, the epidemiologists that come out from this training, what role they are playing in implementing the GHSA, especially the core capacity of, outbreak investigation and surveillance?
That's a great question. The PTP program is basically a blessing for Pakistan, and one of the important program. Part of that program as a student, as a faculty to that program. And this was established in 2006, and this is available in 100 countries the globe. And now, first few cohorts, it was supported by US CDC, and now the government of Pakistan is supporting this program. And from this year onward, the provinces are supporting their fellows to participate in this program. So this is a success story for Pakistan, and all those fellows and trainees and alumni worked very hard during COVID, during H1N1 outbreak, and also in the polio response. They are working, and they are now at very senior level, and they are working for implementation of global health security agenda and also international health regulation. So still we do have to work a lot, because we are having 344 graduates of APTP program throughout the country, and this is very less, because one trained epidemiologist is required for at least 2 lakh population. So keeping in view the Pakistan population and the number of this APTP workforce, so this is very less. We have to work a lot, and we encouraged the provinces and other stakeholders to start and help out National Institute of Health to expand this program. And now the provinces are going to take over this program. They will be supporting their fellows, sending for the training, and NIH will be providing technical support.
Yes, thank you so much, Dr. Mumtaz. Indeed, I think NIH and you yourself and your division, they are playing a very key role in training these epidemiologists and building the workforce. So you are also, Dr. Mumtaz, the national focal point for infection prevention and control. So how do you see what critical role IPC plays in terms of national preparedness? And what are some of the gaps that you see, when it comes to scaling up IPC programs in Pakistan?
Infection prevention control program and infection prevention control issues is very big in Pakistan, and especially in the district level and also at federal level as well, because this issue and this is not even included in the curriculum of doctors and nurses and paramedics. So we are trying to include this in the curriculum as well. We have started working on this. We have developed first ever national IPC guidelines in the country, and now we are developing the curriculum, and we are working the provinces to implement infection prevention and control program initially in 100 big hospitals in the country, and especially at the government setup. In the private setup, if, I can say that the major hospital like Shifa Hospital, Aga Khan Hospital, Shaukat Khan, I mean, hospital like that, they are implementing infection prevention and control procedure because they have been assessed by ISO certification, or their level has been expanded and upgraded. But at the government level, we have to work a lot. We do have many healthcare associated infections. We do have much more antibiotic resistance. We do have much more infections. So we have to work a lot, and we have to work with multi-sector to control this issue in Pakistan.
What strategic priorities do you think that Pakistan should focus on, to ensure progress on implementation of GHSA?
So if we study the National Action Plan, we do have all the 19 areas. We have prioritized the actions as a short term, mid term, and long term. And those are basically the strategy, the priority for developing the health system in Pakistan. And there is one question: how is biosecurity prioritized within Pakistan GHSA framework, and what kind of challenges in implementation? So, Dr. Masab, you answer this question because you are looking after biosafety and biosecurity.
Yeah. So when we talk about biosafety and biosecurity, I think one of the key areas is raising awareness among laboratory staff, and providing them trainings, and then capacity building is very important. We do have a national laboratory biosafety and biosecurity policy, and that was developed in 2017. So all the labs that are working with biological agents, they are bound to follow the policy. So I would say, if we talk about at the national level, implementing the policy, it is important, and similarly, training HR.
I am Dr. Fawad from FETP alumni from 5th cohort. It was a nice presentation by Dr. Mumtaz. I had one suggestion regarding from oral, as I am in close contact with all of my colleagues working in all the provinces. As we are saying that we are facing issues regarding response component overall, as compared to capacity building, we are strong. I am talking about all the provinces. But if you look at the response, our response component is weak. And my suggestion regarding this is that we should sensitize our top level at DG health offices of every provinces, that they should direct CEOs, DHOs at district level to encourage that they should declare outbreaks alerts maximum, so that when they are doing outbreak response activities, they are protecting their communities. I have seen that in many areas, most of the district officials are concerned that if they are declaring an outbreak, they will suddenly, and any accountability will be initiated against them. So if my suggestion is that if top levels, we are going to sensitize them that no accountability will be initiated against you, you are hereby encouraged to update regarding any alert outbreaks. So I think it will be helpful for the system. This is my suggestion. Thank you.
Thank you, Dr. Fawad. It is really good suggestion. And if you compare this with one issue, when you help out any case on the roadside accident, or anyone and problem on the road or at the side, anywhere, being even a doctor, you are made accountable, and then you just go to courts and answer the things, and this is like that. So, in the health department, especially reporting the disease and time, and responding to that disease and time, this is very important. But keeping in view the today's world, this is basically the social media world. If you don't report the disease in time, someone else will report, and someone else will pick. And we receive many emails from outside of Pakistan and from other organizations in Pakistan that there is an outbreak, and those district and especially in that union council, and we receiving cases much more, and then we tell the health department that can investigate. So if the health department is not going to report, someone else will report. So we have to be proactive in disease reporting, and we have to respond in time, because this is a different time nowadays. And you are very right that we are facing issues in the reporting and responding the outbreak. And especially nowadays, we don't have funds for outbreak response in the provinces. We are supporting, NIH is supporting outbreak response in the provinces right now, but we don't
Yes,
have
sir.
much more funds to support each and every outbreak. So the
Yes,
provinces has to allocate funds for, especially for emergency response, for disease outbreak response, and for the capacity building of the healthcare staff.
Once again, thank you so much, Dr. Mumtaz, Chief CDC, NH Pakistan, for taking time out. I'm really grateful to you. I'm also thankful to all the participants, especially those who have made such, encouraging comments and who have asked questions. Lastly, I would like to again mention that we will be, making this video available at our Viral Insights YouTube channel, so you can watch this later on. And I will end this webinar with the message that Dr. Mumtaz said, that so under the global health security and agenda, our collective goal is to strengthen capacities to detect, to respond, and to prevent infectious disease and public health threats, both at national and at global level. So we do have to play important role in this. And with this, thank you so much, and hopefully we'll meet again. Thank you.
thank you.
Thank you very much, Dr. Masab, and each and everyone present during this webinar. Thank you so much.